Hi everybody. Today we are talking about confidence and knowledge gaps for caregivers and the fact that there's always more than meets the eye if you are a caregiver. I'm Pamela D. Wilson. My website's pameladwilson.com. Click on the links below. Follow my YouTube channel. Share these videos with other people who are looking for hope, help, and support. Now, caregivers, it is no doubt in my mind that you are super special. You're special by virtue of the fact that you care for others and you take responsibility for the care of others, many times to your own detriment or your own lack. But in caregiving, as in so many areas of life, there are things that we don't talk about because as a caregiver, we may be embarrassed to share information. We may think, oh, I'm probably the only one that's going through this experience. Well, I can tell you that there's always more to the story. There's more than meets the eye. When I was a care manager, I would have so many families who would come into my office and say, oh, Pamela, we are so embarrassed to tell you this. Our family doesn't get along, or my parents are difficult, or, 10 other different things. And what I would tell them is that families are not perfect. Lives are not perfect. Situations are not perfect. You're not the only one going through this, even though you may feel so alone and lost. And what I would see is that caregivers would suffer confidence gaps, even though they were doing a really, really good job, or they were doing all they could. As a caregiver, how do you get over these confidence gaps, these days when you feel like you're not doing enough, or you can't do enough, or you'll never be good enough? Well, the answer, and it's difficult, but it's easy. It's finding and accepting help and support. Now, I know this is like, you're going to say, I don't have time, Pamela. I want to do this myself. Caregivers are the worst at accepting help from other people, even though all you do is help other people. Whether this help comes from healthcare providers or social groups or joining a caregiving group. The way that you gain more confidence in your abilities to care for other people and to make decisions is by becoming more educated, by learning more to remove those doubts and those gaps about whether you're doing a good job or doing the right thing or whether you made the right decision. Now, we're all going to make mistakes. That's part of life. That's part of learning. But the other thing that we don't talk about as caregivers is there are so many other factors that affect the health of the people that we care for and our health and our well-being. The healthcare system, believe it or not, of course, has a term for this. It's called social determinants of health. SDOH is the abbreviation. And these are things that affect our lives. So early childhood experiences with parents. Maybe you had parents who worked and you were home alone all the time. Maybe they were verbally abusive or physically abusive, or maybe your parents had drugs or substance abuse issues. Those affect the caregiver's health and the way that we look at life, as does our level of education, where we work and what our workplace environment is like, where we live, the home we live in, whether we live in a safe neighborhood or a neighborhood where there's a lot of violence and we're afraid to go out at night. Even the neighborhood environment. So are there parks where you live? Can you get out and be in nature? Or do you live in a big city where you walk out the door and you're on city streets and there's trash everywhere and there's people everywhere? Transportation is an issue. Do you have a car? Can you drive? Do you take public transportation? All of those things affect the ability of us to manage our lives and to care for other people. So if you are the caregiver and one or more of these things is affecting your life, trying to balance your life. So you're working and you're a caregiver. You're married. You're taking care of your children. Maybe you're worried about paying the rent or health insurance, or you don't know how you're going to get prescription drugs. Sometimes it does feel like it's all too much, and it really does affect our confidence level. But I can tell you that there are solutions, and as a caregiver, you've got this. The one step forward to take is search for resources in your community. So contact a local area agency on aging. Search for 211, which has a lot of resources. Contact a local community health center, because these health centers have access to a lot of other information and resources in the community that you may not be aware of, especially if you're having trouble managing healthcare and insurance issues and getting care for your loved ones. If you're taking parents to the doctors or you're involved in their medical care and a doctor recommends something and you're thinking, oh, I don't know if we can do that, don't be silent. Tell the doctor it's an issue. Doctors don't ask about how your life is as a caregiver or what personal issues you have or if you can make it to the next appointment. They're just saying, hey, here's a prescription to take and I need you to come to this appointment. They're not asking if you can afford the medical co-pays or if you can pay for the prescriptions or if you have a car and you can drive your parent to the appointment. Doctors don't realize that there's all these other factors over here that affect whether you can actually do what they are suggesting that you do. So it's important for you to speak up and say, doctor, that's a great recommendation, but you know what? We don't have the money to pay for this prescription. Or you're telling my parent that they need to take vitamins. Well, we can't afford those either. And you want mom or dad to give up, I don't know, processed foods or whatever. Well, we don't have the money to buy fresh foods. You've got to be honest with healthcare providers about the issues that you're having, because many of them do have access to outside resources. In so many cases, there are outside resources. But you have to be honest and upfront about the problems that you're experiencing, the troubles that you're experiencing, so that someone else can say, hey, you know what? We have a solution for that. Then you actually have to accept the help. Don't be so proud that you can't accept the help, because it's going to benefit you and your parent. Also, though, be very thorough in investigating these recommendations and the programs, because only you know 100%, 1000% what your situation is like day in and day out and what you can actually do. So for many caregiving families, there are limitations, and this is the hard part, right? You want to do everything you can to help your parent, but there's limits to what you can do as a caregiver. You know, you need to remain employed. You have a family to take care of. You may not have the financial resources to help your parents, and they may not have the resources either. So you may have to look at public programs. You may not have a car. You may not be able to get time off work to take a parent to a doctor appointment. Caregiving is stressful. Life is not perfect. There are so many other things on the periphery, on the outside of daily life, that make caregiving difficult. But all through this, if you truly are honest with the people who are trying to help you about what you can do and what you can't do, the gaps you have, the things that you need help with, and if you accept that help, even though you may still have a few gaps, or you still may make a few mistakes, or there's still some limitations on what you can do, you will begin learning about resources and educating yourself and gain the confidence that you need to eliminate many of these caregiver challenges. And again, I'm not saying that it's easy, but looking for help and accepting help is the first way to open that door to change your caregiving situation for the better. Because it is okay to say, I don't know how to do this, doctor. I don't know what you're telling me to do. We can't do this. We need help. Can you help us? Many times there are good people out there who are willing to provide hope, help, and support. Thanks for being here. Thanks for watching this video. Please share it with other people that you know who are looking for hope, help, and support, and who need a little bit of direction about how to manage caregiving, life, aging, and everything in between. I'm Pamela D. Wilson. Have a fabulous day today. I'll see you all again soon in another video.